Okay, hello, everybody. Hello, this is Dr. Garrett Smith, the nutrition detective, and we are going live today to go over how vitamin A, which is not a vitamin, only a poison, and I've gone over that on this channel before, depletes your B12, it depletes your folate, and it will increase your homocysteine, and this is shown over and over and over and over again in multiple papers that we're going to go over today. So first thing, I want to go over how you can find more information from me just real quick. The vitamin A detox program is at nutritiondetective.work, and you can find the other research places. The blog that I'm going over today, the blog post that I'm reviewing in this video today, is at nutritionrestored.com, and so is my research forum where I have over 400 posts and you can read about all that stuff. So if you want to find more information, that's where you go. I'll go over more stuff about how to contact me at the end of this video. We just want to get into the meat right now. So for those of you who have found yourself in the epigenetics realm and the MTHFR and the CBS and the sulfation and the methylation and all that stuff, you're going to want to stay until the end of the video because there's a very important study that I go over at the end where it ties this all together. And this can be why you find yourself supplementing with things and never getting out of that loop. It doesn't mean you're never going to fix this issue, but if you don't know how to fix it, then you're going to be taking that stuff forever. And what if you didn't have to? So let's head into it. First, I want to do a quick review of vitamin A stuff that I have gone over in my other videos. Especially, I go over all this stuff in detail on the infertility and vitamin A video. So there is an epidemic of vitamin A toxicity going on. A cadaver study showed about a 33% rate in American cadavers, whether they died of accidents or whether they died of natural causes. So about 1 in 3 people in the US, by the gold standard of vitamin A toxicity diagnosis, was vitamin A toxic, is vitamin A toxic. African countries in the past, in the 50s or 60s, I recall, it was they were up to 50% vitamin A toxicity by the same method. So you can imagine today it's probably worse because vitamin A has only been pushed more. So that's number one. Next, regardless of what any so-called expert on the internet tells you, there is no difference in the chemical formulation or the toxicity of natural vitamin A versus synthetic vitamin A. There is no difference, and no one can show me research otherwise. The only thing that people might be able to say is that they tend to see vitamin A toxicity more in people who supplement. Well, that's kind of a duh moment because obviously if you're eating vitamin A and you're supplementing on top of it, you're going to become even more toxic. That doesn't mean you're not going to get toxic from foods. I have a video on here about all the case studies and research on people getting toxic in one meal of liver. So obviously vitamin A is toxic, and this can be from fish even, and I go over that. And then there's the people who got toxic from vitamin A from foods, like the famous Carrot Man study, where a guy started juicing tons of carrots and he got vitamin A toxicity. So foods are not out of this. And next, we're going to go into vitamin A, what it turns into in your body. And if you go and you look at all the vitamin A metabolism or degradation, because your body's trying to break down this poison, the vitamin A metabolism, vitamin A that you absorb that gets into your system, some, if not all of it, turns into what are called retinoic acids. Okay? There's 3 main ones, but I'm going to go over one really quickly, or one's really important, and one I'm going to cover quickly, but one is 9-cis retinoic acid. 9-cis retinoic acid, when it's sold to people in pill form, and it has a black box warning, the biggest warning in all of pharmaceutical medicine, is Accutane or Roaccutane, okay? Your body, this is in the science textbooks, your body turns some of the vitamin A you absorb into the exact same chemical as Accutane, which is also known in the research as isotretinoin. That's the generic term. So vitamin A you eat turns into isotretinoin, aka Accutane, aka Roaccutane. So when we look at studies today where they're looking at taking isotretinoin, your body turns vitamin A into isotretinoin, 9-cis retinoic acid. Wait, no, I'm getting it confused with alitretinoin. Sorry, I get my isomers mixed up sometimes. It's 13-cis-retinoic acid. 13-cis-retinoic acid is isotretinoin. 9-cis-retinoic acid is alitretinoin. Sorry, I got them confused in my head there. And this is live, so I don't get to edit that out. The other one is all-trans-retinoic acid, which is also known as retin-A. Your body turns some of that vitamin A you eat into retin-A. Why is that important? Well, when they gave veterans retin-A topically, they had to stop the study because too many of them were dying early. So yeah, maybe you don't want to take a lot of that into your system. Anyway, that's really important when we go over these studies about how vitamin A, especially in the form of 13-cis-retinoic acid, depletes your B12, depletes your folate, raises your homocysteine. Bad. And really important for those of you who listen to this and you go, I'm going to go to my doctor and get tested for vitamin A, see if I'm toxic. That's not going to work, because the research shows over and over that your bloodstream level of vitamin A, because vitamin A is stored, your bloodstream level of vitamin A, of serum retinol is what the test is called, has nothing to do with how much you stored in your liver, how much you have stored in your liver or your other tissues. Nothing to do with it. The people who are the most toxic sometimes have the lowest levels. Now, that's a complicated topic. It means their liver is not doing well. It's a really not a good sign to be really vitamin A toxic and have low levels in your blood. I've seen it. I've helped people out of it. It's not a good situation. So don't go to your doctor and be like, well, my doctor says I'm fine. The research says that they're just grasping at straws. It doesn't, your blood vitamin A has nothing to do with how much you have stored. At least until you've been depleting it for a long time, and that's a whole nother topic. So anyway, I've gone over all those topics in my other videos. The most recent one where I covered them all was the infertility video. So if you want to go back to that and see all the research on it, go there, okay? So now we're going to get into it. This is from a blog post. I'm going to go over it. B12 deficiency, folate deficiency. Tons of people on the internet are freaking out about it. They're taking massive doses of B12 methylcobalamin. They're taking massive doses of methylated folates. And they kind of sometimes play a bit of a victim that, oh, I just can't get enough of this. Do you actually think that your human genetics would have passed along if you needed basically pharmaceutical doses of B vitamins? And there was no but before there was pharmaceutical doses of B vitamins, and you can say supplementary, but you're really taking a purified, isolated form of vitamin that's a lot more like a pharmaceutical than it is food, right? So do you think that you would have passed on your genes if you had to live on pharmaceutical doses, or you can say orthomolecular doses if you'd rather, of these vitamins? It doesn't make any sense. So something is causing these B12 and folate deficiencies. Why can food these days not keep you up on it? Okay, so think about that. So in the research, we are going to connect vitamin A to these deficiencies. Now, let me get down to this. The first paper we're going to go over. I go over the title of the paper, and then I go over the quotes that I took out of it. And I tend to raise my finger in the important parts. And then I'll cover anything I need to afterwards. So the title, first paper, Decreased Vitamin B12 and Folic Acid Concentrations in Acne Patients After Isotretinoin Therapy, a Controlled Study. Here's the quote. In total, 120 patients with moderate and severe acne vulgaris who completed 6 months isotretinoin therapy and 100 healthy individuals who constituted the control group were included in the study. A statistically significant decrease was detected in post-treatment vitamin B12 and folic acid levels. End quote. That's pretty straightforward, right? Next paper. Effect of isotretinoin treatment on plasma holotranscobalamin, vitamin B12, folic acid, and homocysteine levels. Non-controlled study. Okay, quote. Some previous studies reported elevated homocysteine levels after treatment with isotretinoin. Some side effects have clinical presentations similar to vitamin B12, B12 deficiencies, folic acid deficiencies, and hyperhomocysteinemia. In the present study, we evaluated the plasma homocysteine levels, the vitamins involved in its metabolism, vitamin B12 and folic acid, and holotranscobalamin, HoloTC, a transport system for vitamin B12 absorption in patients receiving isotretinoin treatment for acne vulgaris. Post-treatment vitamin B12, folic acid, and HoloTC levels were significantly lower, while homocysteine levels were significantly higher compared with initial values. End quote. So B12 was lower, folic acid was lower, homocysteine was higher, and the holotranscobalamin, part of the transport system of B12, was also lower. Remember, isotretinoin, we're going to talk a lot about isotretinoin studies in this, because that's what your body turns some of the vitamin A into. So whether you're taking a pill from a pharmaceutical company or not, it's the same compound. No one can argue that these compounds are different. Chemists are going to analyze them, and they're going to be exactly the same chemistry. Somebody analyzing the urine of a person, and they see 13-cis-retinoic acid in the urine, they cannot tell you whether that came from a pharmaceutical pill or whether it came from vitamin A you ate. And this is in the research. Okay? Moving on. Homocysteine, folic acid, and vitamin B12 levels in patients on isotretinoin therapy for acne vulgaris. A meta-analysis. So they took a bunch of studies, right? Quote, results. A total of 10 studies consisting of 592 patients were included in the meta-analysis. Plasma homocysteine levels were significantly increased after isotretinoin therapy, whereas folic acid levels were significantly decreased after isotretinoin therapy. End quote. Now remember, if you're out there trying to eat healthy and doing all this stuff, the false notion of eating healthy tends to include tons of high vitamin A foods, depending upon which angle you're coming at it from, whether you're coming at it from all the brightly colored fruits and vegetables angle, or whether you're coming at it from, like, let's say, a carnivore, let's eat nose to tail approach, or let's eat tons of eggs and egg yolks, because egg yolks are full of vitamin A. Whichever direction you come from the standard eating healthy approaches, you're going to be getting tons of vitamin A unless you're trying to not get it. Next, efficacy of folic acid and vitamin B12 replacement therapies in the reduction of adverse effects of isotretinoin, a randomized controlled trial. Now, let me just stop there. They're going to give these people who took isotretinoin 13-cis-retinoic acid, which your body makes. They gave them B12 and folic acid supplements to try to reduce their side effects, because they knew the side effects were coming. Okay? Quote, we conducted a randomized controlled trial to investigate whether folate and vitamin B12 replacement therapy with isotretinoin would be useful for preventing hyperhomocysteinemia. A total of 66 patients with acne were randomized into two groups. Group A took isotretinoin, folic acid, and vitamin B12, whereas Group B took isotretinoin alone. Treatment was continued for 2 months. Blood homocysteine, folic acid, and vitamin B12 levels were measured before and after treatment. In Group A, which is the isotretinoin plus folic acid plus B12, a significant decrease in homocysteine level was observed after treatment, although it was still within the normal range. Folic acid and vitamin B12 levels significantly increased. In Group B, no significant changes were observed in the levels of homocysteine and vitamin B12, but folic acid levels decreased significantly. So that was the isotretinoin alone. Okay. And in the Group A that got the 13-cis-retinoic acid form of vitamin A, also known as isotretinoin or Accutane, they had a decrease in homocysteine levels when Accutane, isotretinoin, normally raises it. In Group B, where they just got isotretinoin, they saw the folic acid levels go down significantly. Okay. Next paper, successful treatment of isotretinoin-induced musculoskeletal pain by vitamin B12 and folic acid. Here's the quote. We reported 6 patients with nodulocystic acne who reported musculoskeletal pain after taking isotretinoin, which successfully treated with daily supplementation of folic acid and B12. End quote. I always tell people that if you're taking an essential nutrient, generally if you're taking an essential nutrient and you feel better from that essential nutrient, what that implies is that you have a deficiency of it. You need something essential. B12 and folate are essential. They are depleted by vitamin A. Give you some of that nutrient, you feel better, or you have symptoms go away. It implies you were deficient. So how do we fix it? Well, if vitamin A toxicity causes you to be deficient, fixing the root cause is getting rid of the poison that's depleting you. It's not to just take massive levels of this nutrient in a supplement form forever. I'm after fixing the cause. If everybody else just wants to supplement their symptoms and ignore the root cause, that's fine. That's not what I do. Okay? I get people on fewer supplements over time because we fix the root cause of their deficiency. I don't put people on more and more supplements over time. I can tell you that figuring out this vitamin A toxicity thing has made it so I can get people on many, many fewer supplements. And I only use generally essential nutrients for the main part of my treatment. We do some other things, but mainly we're sticking with minerals and maybe some vitamins. So another one, severe aphthous stomatitis secondary to vitamin B12 deficiency with isotretinoin therapy. Here's the quote. The progressive development of glossitis and oral ulcers during the second cycle of isotretinoin therapy, together with the absence of evidence suggestive of pernicious anemia or inflammatory bowel disease, and the lack of recurrence after treatment discontinuation, strongly suggest that the development of vitamin B12/folate deficiency in our patient was strictly related to isotretinoin therapy. End quote. That was all sorts of problems around their mouth. They're talking ulcers. They're talking, swelling and inflammation inside the mouth. It's bad. Okay. And it went away when they stopped the poison, the retinoic acid form of vitamin A, which again, your body turns vitamin A into that before it gets rid of it. Next paper. This one's a little longer. Vitamin B. Oh, this is not the really important one. That's a couple more down. I'm going to try to stick to the most important parts. Vitamin B12 and folate deficiency anemia associated with isotretinoin treatment for acne. Quote, we report a case of anemia due to B12 and folate deficiency developing 8 weeks after treatment with isotretinoin for acne. On the 8th week, I'm skipping ahead. On the 8th week of treatment, she started to feel tired and dizzy. 1 week later, she felt sick with epigastric pain, vomiting, and diarrhea. On admission to the hospital, she looked pale with a pulse rate of 90 beats per minute and normal blood pressure and temperature. She had extensive crusting around the mouth with erosions of the lips and redness of the buccal, that's the cheek, inside the cheeks, mucosa. She also had multiple painful perianal ulcerations. Not fun. Continuing on, the patient's isotretinoin was discontinued on admission to hospital, and she was treated with B12 and folate supplements with rapid improvement, correction of her anemia, and normalization of her white cell count. She was discharged in good condition and remains well. Continuing on, we report an interesting association between B12 and folate deficiency anemia with isotretinoin treatment for acne. Our patient was clinically well before isotretinoin treatment, and her symptoms stopped rapidly after discontinuation of isotretinoin and initiation of B12 and folate replacement. The mechanism of her B12 and folate deficiency is not entirely clear. In this case, anemia and neutropenia occurred possibly because of B12/folate deficiency or direct drug toxicity. More likely, an accelerated development of isotretinoin toxicity with colitis, resulting in B12/folate deficiency anemia in a marginally deficient but clinically normal patient led to the development of the symptoms. End quote. Next paper, depression, isotretinoin and folic acid, a practical review. Quote, isotretinoin can create psychiatric problems, including depression and suicidal ideation. These neuropsychiatric problems are very similar to disorders secondary to hyperhomocysteinemia, vitamin B12 deficiency, and folic acid, vitamin B9 deficiencies. Okay? End quote. let me see, is this the one? Yes, here we go. For those of you, this is the last study. For those of you who are into MTHFR and epigenetics and the CBS and sulfation genes and all of that stuff, you're going to want to listen very, very closely to this. Quote, oh, sorry, I didn't go over the title of the paper. The effects of isotretinoin therapy on serum homocysteine, folate, and vitamin B12 levels in patients with acne, a meta-analysis and meta-regression. Quote, studies have revealed changes in the serum level of homocysteine, folate, and vitamin B12 in patients with acne receiving isotretinoin treatment. However, the results were inconsistent. Hyperhomocysteinemia and deficiency of folate and vitamin B12 following isotretinoin therapy may potentially increase cardiovascular and neuropsychiatric risks. We sought to examine this potential side effects by conducting a meta-analysis and meta-regression. 12 studies involving 684 patients were included. The characteristics of the included studies were summarized in Table 1. After isotretinoin therapy, homocysteine levels significantly increased, folate levels significantly decreased, and vitamin B12 levels remained unchanged. Subgroup analyses revealed similar results after isotretinoin treatment for 1 to 2 months and 3 to 4 months. A meta-regression analysis revealed an association of higher cumulative isotretinoin dose with a larger decrease in folate levels. No publication bias was detected. I'm going to take a break there for the people who took more of the poison, which is vitamin A, had worse folate deficiency. Okay, so if you're really folate deficient and you're trying to eat these healthy foods and eat lots of dark leafy greens and eggs and liver and yellow vegetables and orange vegetables and red vegetables, and you're wondering why your health is not getting better, or tons of dairy, let's say those of you in a certain Weston price group, if you're wondering why you're not getting better, I'm going to tell you, they're telling you the wrong thing about vitamin A, okay? So here we go. Mechanism of isotretinoin's effect on the 1-carbon metabolism pathway was first hypothesized by Schulpis et al. To be an inhibitory effect on the cystathionine B synthetase in the transsulfuration pathway. You guys should be familiar with that. I believe that's the CBS gene. Vitamin A inhibiting that gene. Another hypothesis is that isotretinoin likely inhibits the remethylation pathway via folate and vitamin B12 reduction, since remethylation requires 5-methyl tetrahydrofolate, a folate derivative, as a substrate and vitamin B12 as a coenzyme. This prevents homocysteine from converting to methionine. The mechanism of how isotretinoin could lead to lower folate or vitamin B12 levels is unknown. Decreased absorption of these vitamins has been suggested as a possible cause. Additionally, we cannot exclude the possibility that isotretinoin may cause subclinical liver dysregulation to affect folate and vitamin B12 metabolism. Let's see. I'm going to just, this last part, when the cumulative dose of isotretinoin reaches 70 milligrams per kilogram, this, what is the SMD? They didn't say what the SMD is. This SMD decreases to minus 0.70, indicating a high sensitivity of folate level to cumulative isotretinoin dose. The more isotretinoin, 13-cis-retinoic acid you have in your body, the more it's going to affect the folate, the more it's going to deplete your folate. In conclusion, isotretinoin may cause hyperhomocysteinemia and folate deficiency in acne patients. We also found a dose-dependent relationship between cumulative isotretinoin dose and decreased folate level. End quote. So, if you're still here, what this last paper is saying, they're finding authors that theorize that 13-cis-retinoic acid, which is a byproduct of all vitamin A that you eat and absorb and metabolize, this 13-cis-retinoic acid may be negatively affecting your sulfur metabolism pathways, the CBS system, and your methylation pathways. There's lots of epigenetics people out there having a fit about these pathways and trying to give people all sorts of supplements to fix it. And I'm going to tell you that it's probably a poison that people are taking willingly that is causing these problems. So, And this problem does not just go away. When people take isotretinoin, Accutane, and their problems go away afterwards, they're the lucky ones. Some people, their problems with taking this form of vitamin A, it is a form of vitamin A. It is vitamin A. It is one of the considered the active forms of vitamin A. If you want activity like this that depletes your nutrients and makes a marker of inflammation in your system go up in terms of homocysteine, maybe you want to look at how you pick your nutrients. This is all basically, to wrap it all up, this stuff is all connected. We have been duped. And if you didn't know, Bill Gates' favorite vitamin is vitamin A. So for what that's worth, take it for what it's worth. If you think vitamin A is great, and maybe you have your thoughts about Bill Gates, and you know Bill Gates' favorite vitamin is vitamin A, and maybe that gives you pause, that's up to you. So that's all I have on this subject for today. So what I wanted to just end with is, for those of you who maybe are starting to look into my work and start to realize that vitamin A is not a vitamin, never has been, and it's only a poison. And we have Grant Genereux, who's been avoiding vitamin A for 6 years, and his vitamin A on testing is almost undetectable. He's at the lowest level the lab can go. 6 years, no vitamin A. He's only getting healthier. I have multiple people who have been avoiding vitamin A for going on 2.5 years now. They're getting better. Okay, it's not a vitamin. If you are interested in the original vitamin A detox program that I put out there, that you can find at nutritiondetective.org. If you are interested in getting results faster, refilling these nutrients that vitamin A depletes, I would suggest that's where you would want to contact me for individual work, and that is through nutritionrestored.com. And that's where you can go to the contact page, and you can contact Julie. I do free 15-minute chats if you have some questions before you get started. My packages include, we use hair testing, we use blood testing, and there's individual consults, and there's support included, and you get access to the basic vitamin A detox program as part of it. So if you are interested in working on this problem, it is a real problem. Remember, I said the blood test for vitamin A does not tell you if you have this problem or not. The only thing that really can tell you is a liver biopsy or a test that no lab in this country sells, which is serum retinol esters, all of them, not just retinol palmitate, but nobody sells it in the US. So I don't think anybody sells it anywhere. Weird that they wouldn't sell the test that tells you that you're vitamin A toxic from your blood, that nobody tells you that, and you can't get a liver biopsy to test it. I wouldn't want one. Weird that you can't really test your vitamin A toxicity. It's almost like they don't want you to find it. So anyway, hope you all enjoyed this. I will see you next time. I'm trying to put out 2 videos a week. And the link to the blog post where all these references are is in the description below. I always include my references. And if you want to see the metabolism pathways and the other stuff, go to my other videos, the other bigger, long slideshow videos, and I go over that research, and I'm going to be doing them in little pieces too. I'm going to be breaking them down so you can go see those concepts individually, so they're not part of bigger presentations. So anyway, hope you all enjoyed it. I will see you next time. Bye now.